I perform surgery on all different body parts. I did a fellowship in New York City specializing in shoulder and elbow surgery because I was interested in it. And the shoulder, it's got the most range of motion of any joint in the body. And to do that, you have to have all these muscles and ligaments and tendons working together in a coordinated way, unlike the hip, which is more like a ball and socket joint. So it's just, it's a very interesting, joint. People can throw baseballs 100 miles an hour and do gymnastics with an unbelievable range of motion and still have a stable joint. I take care of people in all age ranges with all different types of problems. Young kids who have instability problems from maybe sports. They're throwers, athletes. They have an injury and dislocate their shoulder or have an unstable shoulder, ranging all the way to older people who have arthritis in their shoulder. I'm a surgeon. I tell my patients I'm a surgeon. I love to do surgery, but I wouldn't want to have surgery on my shoulder or body part unless you absolutely need to have it done. So I will, treat them as if though they were family, or how I would want to be treated if I were in their shoes. And I'll go through, make sure we have the correct diagnosis, get a good history from that person, make sure I listen to them, and then get the appropriate tests, x-rays, MRI, or whatever's needed, then get a working diagnosis and make sure we're all on the same page and make decisions together. Because, you can have a 25-year-old person who's very athletic, or another one who is not very athletic. You have to go with who that person is and what their desires are, and then make a decision. So not everyone needs surgery. At Premier Orthopedics, we have in our office here 2 non-operative physicians who are sports medicine trained, who are seeing patients all the time, and they're down the hallway. So if there's a question about a person needing treatment such as surgery, we can discuss that just right here in the office, and look over their test results and talk about the patient's desires, and then that patient can easily be transferred to me if they need surgery, and we can talk about different options in that way. So yeah, it's a great setup where we have everybody here in the office together. Well, we've been involved with this community for over 50 years, and now part of Premier Orthopedics. We still are involved, and probably even more involved. We take care of the local high schools. We have sometimes physical exams for them. We get athletes in our office that day when they call. We work with all the trainers, so we are very involved with the sports programs here. I love what I do as far as the surgeries and the patients, and seeing them get better and appreciative. And there's the traumas that I take care of that, sometimes you're up late at night, but in the long run, if that person's doing better, that's great. That's the whole goal.